This is a general overview of the homeless management information system used by the Blue Ridge Continuum of Care as administrated by the Council of Community Services, who serves as the HMIS lead organization for the Blue Ridge COC. The Homeless Management Information System, or HMIS, is a comprehensive client database used for sharing information between agencies to better provide services and to track homeless data in order to prioritize resources and connect people with referrals for service. The One of the main things that the HMIS provides is a way for us to collect client data. This is a sample client profile. We collect basic demographic data, including social security numbers, dates of birth, uh, things like their preferred pronouns, gender, sexual orientation, and veteran status. Some of these are used for just for reporting, but others are used for service prioritization. We can also enroll clients in programs and track services in order to do more complex data collection and reporting. Each client, we're able to track their history in the History tab. In the History tab is one place at a glance where we can see services that have been entered for them. We can see whether they've been uh, had program referrals made for them. We can see program enrollments. We can see shelter stays. We can see other types of contact made. We can see when they've had reservations for a shelter bed made. There's so many things we can track in this system, and and the HMIS that we use is highly customizable and allows us to track pretty much anything that agency asks us to. One of the main things that HMIS is used for is connecting clients to housing resources, and we are required to use a coordinated entry system in order to prioritize clients based on their vulnerability. We maintain a list of clients called the by names list, sometimes also called a community queue. Each client is given a vulnerability assessment, which in our uh, community is called a CVAT. Um, they are added to this community queue, and then we have regular case conferencing meetings multiple times a month to discuss clients' cases, pull them out for referrals, and make referrals to housing programs. We collect and track some specific data on the community queue, including whether they're chronically homeless, whether they're disabled, their CVAT score, how long they've been on the by names list, um, where they're currently receiving services, the last activity agency, how many people are in their household, um, and also what agencies are most in contact with the clients and the staff who most work with them, so we know who to contact in order to help provide services. This is a required tool by HUD, but it's also essential for helping us prioritize people for housing services and other services. In addition to maintaining this by names list, um, Clarity HMIS also has robust reporting features. They have a reporting library that provides already created reports that allow us to track information and to provide summary data. For instance, this is a report called an annual performance report. I pulled this one for sheltered individuals for the last fiscal year, the 22-23 fiscal year. It allows us to see how many people we've served, and it also breaks down the information into um, demographic data at a glance, so we can see how many people were served by gender, how many people were served by age, how many people were served by race and ethnicity, how many people experience physical and mental health conditions. This report also allows us to track what their living situation was at the time they became homeless, whether they were living outside, they were in an emergency shelter, um, they were coming out of an institution like prison or a hospital. Um, it allows us to track their income levels. We can track their disability categories, whether they have health insurance or not, how long they have participated in particular projects. We can track their housing outcomes, whether they had what their exit destination was, and whether they went back to homelessness after participating in a program, or whether they were able to be housed temporarily or permanently. Um, so these are really essential reports that we use in the Blue Ridge COC to track our progress working with clients. In addition to the provided report library, we also have the ability to create custom reports. For example, we've created client demographics report so that we can count the number of people served by location or by zip code. Um, and it can also break it out into demographic data um, by zip code. And we use these custom reports for some of our grant applications and also just to keep track of where homeless individuals are coming from. There's some other features that I could take longer to demonstrate, but such as the street outreach module, the shelter module, and things like that. But really, HMIS is a really essential tool for us to help the homeless and at risk of homelessness population in the Roanoke Valley.